I'm very excited to introduce Dr. Oana Danciu. Dr. Danciu practices in the Division of Hematology Oncology at the University of Illinois. She specializes in the treatment of breast cancer, and her research interests include the development of clinical trials using experimental therapeutics. Dr. Danciu is an active member of the American Society of Clinical Oncology and will be presenting on how to manage stress and anxiety through COVID-19.
Hello, I would like to thank the organizers for inviting me to discuss this very important topic of managing stress and anxiety during COVID-19 pandemic. Being diagnosed with cancer and going through invasive treatment is stressful by itself. Being diagnosed with breast cancer during the pandemic is even more stressful. The COVID-19 pandemic has resulted in new sources of anxiety and stress for many cancer patients, caregivers, survivors, and for multiple reasons, the COVID-19 has been a significant added burden for all of us, but even more for those affected by cancer. So when I look in our practice, the way I would categorize our breast cancer patients during the pandemic, I would look at patients that were newly diagnosed during the pandemic. And for those patients, we had to see delays in diagnosis or delays in treatment, patients not being able to get their surgery in time or get the type of surgery that they wanted. That obviously led to a lot of stress and frustration for patients and physicians. And then the next group of patients that I could think of, those patients that have been already on some kind of adjuvant treatment, such as chemotherapy or needing to start radiation therapy. For that group of patients, again, we saw delays in treatment where we had to change schedule of chemotherapy agents to minimize visits in clinic and so on. And then there was a group of patients on chronic treatment, those that have been getting treatment with the goal of keeping the cancer under control. And for those patients, the treatment sometimes had to be put on hold since some of the cancer treatments may weaken the immune system and increase patients' risk of severe illness from COVID-19. So during the pandemic, the physicians and patients had to constantly balance the risk and benefits from continuing treatment while facing the risk of this deadly virus infection. Since the pandemic started, we learned a lot how to protect ourselves and how to protect the patients. And cancer centers around the country incorporated the new guidelines from CDC, and we are now in the position where we can safely welcome our patients in the clinic and take care of patients and our staff in a safely way. Overall, this brought a lot of stress on patients and caregivers and family members. So how do we cope with anxiety? What can we do to minimize the stress? Well, you as a patient needs to talk to your care team. Your care team knows your health condition, knows you the best. They are always available to answer questions, to address your concerns. They always have the needed resources, and they can provide you with all those resources. Don't let the fear of coronavirus get in the way of getting the appropriate treatment for your cancer in a timely manner. You may feel nervous about going to the clinic or to the hospital or meet other patients, but reality is that we now know how to manage in a safe way our cancer patients. And everyone is taking precautions to stay safe and make sure your health and your well-being is the priority. Reach out for professional help if you need it. If you feel that the anxiety level, the stress is really too much, just reach out to your provider. There are mental health professionals available, and you should ask for that if that's the case. We always try to get our information. It's we all want to be informed. We want to know what's going on, and that's very appropriate. But when it comes to exposure to news and exposure to social media, there is always a very fine line between getting the appropriate information versus getting overwhelmed with what we hear on the news or what we see posted in the social media. If you feel like that is just too much and creates anxiety for you, just limit the time. So you could do 10 minutes per day or 15 minutes per day and then just stop. Or you could just have a friend or a family member reviewing that and giving you the information without you getting too much exposure. Now, if you are using the social media to connect with friends and family and that it's a source of happiness for you, that's totally fine. But sometimes patients and people may share their own anxiety on social media, so that may actually affect you in a negative way. So just keep an eye on that and find the right balance between getting informed, and getting overwhelmed. Take care of you. You are the most important person right now. And that is true during your cancer treatment. That is true during the pandemic. So what can we do? This is a time when you want to be kind with you and find what is best for you. Watch your diet. Find new cooking recipes that you can try with your family or with your children. Avoid tobacco and alcohol and drinking too much caffeine, since that can make you a little irritated or a little jumpy. Make sure you drink a lot of fluid and stay well hydrated. Get plenty of sleep each night, because this is how you get your energy. And when you wake up in the morning, you feel back to the right energy. Sometimes you may need to take a nap during the day, and that's totally fine. Again, this is the time when you want to do everything that is best for you. Exercise, it has been challenging during the pandemic because we don't have access to gyms or in-person classes as much as we used to. However, just be creative. Whatever it takes, we just need to find a routine so we can continue our exercise inside, outside. For inside, you could sign up for online classes, for yoga or fitness or anything that you enjoy. Invite a friend to join you during those virtual meetings, so that way you have a friend with you and you're doing your exercise. Go for a walk outside. Being in the nature can be very therapeutic for the mind and for your body. Make sure to maintain social distancing though, and wear the mask so you stay safe. Find new activities. Try to find new arts, crafts, listen to new music, or just watch a relaxing movie. And again, you can have one of your friends watching the same movie at the same time. You can chat during the Zoom meeting or any other platform, just to keep yourself relaxed. Connecting with family and friends during this time is absolutely important. And the pandemic is asking us to isolate ourselves, to social distance so we can stay safe. However, we just need to find ways to connect to our family and our friends. Invite your family member over for dinner during a Zoom meeting. Have a coffee with a friend again during a Zoom meeting. Any type of technology, a simple phone call or a video phone or anything that can help you connect with your family and friends, it will bring you benefit. Making emotional connections with others we enjoy spending time with is just an excellent way to reduce anxiety. Meditation, deep breathing, yoga, any other mind body practices are excellent ways to ease stress, and those are good ways to relieve anxiety. And the pandemic is temporary. And I know by now we thought it was going to be over, and it's not, but this is just temporary. We just need to find a way to get through this. So whatever it takes to stay safe, to be happy, to be strong. And I am so hopeful that I will see all of you next year for this amazing meeting, and you will be all safe and stay well.